Please start.
Okay, I'm just starting the class. Okay, so Assalamu alaikum everyone, and we are here to discuss about introduction to MRCPCH, the first part of your exam, which is FOP and TAS. And before giving introduction, let me introduce myself. I am Dr. Aisha Hanif, and I have completed this journey, MRCPCH, last year in 2023, Alhamdulillah, with all my parts, including the clinical ones as well. And we have, Alhamdulillah, covered our one badge as well. And today, we had exam as well. First, October exam has also been, done, and now we start our new second session on it. Just a second. Okay, so let's talk about it. Actually, this is just an orientation session for everyone, and basically we uh, we just this session. Why? Because most of the time, we have so many problems how to start it. So it's not a one-way talk. It's a basically a group talk over this. Whatever in queries you have, we will encounter it. We will give to answer. Okay, this is a session just to help you all. Okay, it's a general session for everyone. Okay, those who want to take a guidance how to start this journey, whether with us or by themselves, whatever they can, this session would be informative. Okay, inshallah. So kindly please move the slide. Dr. Waji, please slide change kar dijiye. Okay, so I've already given my introduction. Okay, now we talk about MRCPCH. Okay, so first of all, for MRCPCH, we all know that it stands for Member of the Royal College of Physician and the Child in Health. Okay, so it's this exam is basically for the pediatricians. Okay, for the children's. So what is the eligibility criteria? Who can give this exam? This is a very, very important question. Most of us think that we should have some form of training, like for example, if we are in Pakistan, we should have an MCPS or FCPS or blah blah whatever MD. No, this exam does not need any specific training. Okay, these trainings are not recognized by the UK. Okay, they just preferred, not mandatory. I'm just using the word preference. They just preferred your experience or working in the pediatric department. Okay, and for theory exam, you do not need any clinical experience to show on a form. You just need only MBBS degree. That's it. They will ask for the MBBS degree to be shown at the time of the registration. So you need to show only this document. So this is the only document which you required for to sit for this exam. Okay, so please make it very clear. You do not need any specific training. If you have only experience in the pediatric department or in a pediatric any form of pediatrics, like emergency clinics or like ward work, whatever, as a RMO or as a post graduation trainee, whatsoever, anything. But it would going to just help you out a little bit, but it is not mandatory. Okay, so I think everyone has a very clear cut idea about criteria. And the important thing is that you can ask the questions. Okay, if you have any question at any time, if you are not, if the things are not making sense, so please stop me and ask those questions. Okay, next slide. Okay. So we have already discussed why we do this, why we give this exam. Okay. So the important thing is that to work in the UK. Okay. So this exam is basically for UK. Please do not confuse it with the Ireland. Okay, for Ireland we have a different exam. Okay, for a UK, if you want to work at the UK, you need a GMC registration. Okay, just like simply in for working in the Pakistan, you should be recognized with the PMDC. Okay, you all have a PMDC registration card with you. Okay, so if you will have that card, then only you can practice in Pakistan. So similarly, to work in the UK, I'm just talking about UK, not Ireland, any other country. So if you want to work in the UK, you need to have GMC registration, and for GMC registration you have two pathways to go with it. First pathway is that the one with this PLAP. Okay, for PLAP pathway you have to give a PLAP exam, and then you can get a GMC. Okay, and the second pathway for those who are specially working in the pediatric department, they should have a full MRCPCH, the theory parts, the clinical parts, everything. They should pass it, and then only they will register themselves with the UK or with the GMC. Then only you can apply for the job. Okay, the important thing is that if you have a GMC, you cannot work in the Ireland. Okay, you can work only in the UK with the GMC registration. For Ireland, the exam, this exam would going to help or would going to make your CV better, but this is not mandatory for IMC registration. IMC registration process is totally different. They just need your house job and all that. They do not require this exam. But for UK, you should clear this exam before going to registration. Now, what is the difference between the PLAB and the MRCPCH? For the PLAB, if you clear the PLAB, you should start the work in the UK as a basic ST1. ST1 is the, you can say over that, a very basic or a very fresh graduate, you can work over there. But if you done this MRCPCH, then you can work as a ST3 or ST4. What do you mean by ST3 and ST4? If we start training over there, they have 8 years of training. So with if we have done the MRCPCH, and if we want to become a consultant, then our training will start from either third level or fourth level. Okay, so maybe we need to do 4 or 5 years of training to become a consultant. Okay, but if you do not want to become do or if you do not want to become a consultant, then what you're going to do, you can work as a registrar. Okay, they can you can work as a senior a special you can work as a specialist, as a registrar with this exam. But if you take the PLAB pathway, then you will be just a basic fresh graduate trainee, or as a ST1 or junior fellow like this. Okay, so is it clear to everyone what is the difference between MRCPCH and the PLAB pathways? Okay, next please. Okay, so we have already discussed about what is the ST3 or ST4. It is basically a training years. Okay, so if you have done this exam, then if you will want to continue your career in pediatrics and want to excel or want to become a consultant, then your 2 or 3 year training will be exempted, and you will start from third or fourth year of the training later on. Okay, next. Okay, now we will talk about the exam. Okay, basically what the exam is. So if you of course, when you came to us, definitely you have your mind that you want to start this journey. Okay, so for starting, you have theory parts, theory exam, and then in the last you have clinical exam. Okay, so basically you have three parts. Okay, so you need to sit 3 times for this exam, 2 times for the theory and 1 time for the clinical. So 3 setting exam is this. Okay, so if you take the first part, I'm talking about the first part, This first part is further divided into two parts, okay? And today we are talking about basically this part. Our talk mainly concentrate on this part. So we have FOP and TAS, Foundation of Practice, Theory and Sciences. These are the subdivisions. Why they do the subdivisions? So again, you have a choice that if you want to take only FOP at one time, you can take it. Only Theory and Sciences task paper, you can take it. And you can take these two papers combined as well. The best strategy always is to take this paper combined, but sometimes what happened, you are unable to get the seat, or so many problems are there, sometimes financial, sometimes seats are not available. So you can take the one part as well, just you can take FOP or you can take TAS as well, no such big issues. But the best strategy is that to take this exam, both of these paper combined, okay? Then you have second part is your AKP. So AKP again is it's two paper, okay, 2 hours के two separate papers होते हैं, but you have to sit for this exam on the same day. ठीक है, आपको ये दोनों exam AKP में जो split होती है, just a time split is there, but you have to take this exam on the same day. Then you have a clinical exam and you have patients and all that. So this exam is mostly a practical based exam. And the good news or the good part is that we in Pakistan, all three parts now have been started, and I have cleared my clinical part in Pakistan. Okay, so now in Pakistan, not only the theory parts are conducting, also the clinical exams are also being conducting over here. So that is why now you do not need to go anywhere. Okay, it's all available in your country. Next. Okay. So now we will talk about the theory exams. Okay, so this we have already covered. The important thing over here is to mention is that uh, if you want to take this exam, okay, whether you are planning for to take in February or later on, whatever your plan, first thing is that make a RCPCH account. Okay, that's very simple. So many videos are available on the YouTube. Any video you can check it and just make an RCPCH account. Okay, so please be very clear. If you have any queries, please ask it right away. Okay, do not take it for the on the last, just ask side by side. So first thing is make an RCPCH account, and this account, either you are planning for fab or for the coming dates, no problem, you can make the account right now. After making an account is free. You do not need to charge anything. They do not cost anything. Just you can make this account. Second thing, which is very, very important, and most of us do not know about it, you have to register yourself. Okay. Registration is mandatory before to take seat. Okay, for registration you should show your degree. Okay, so registration process is second process after making an account. You have to register yourself, you have to show your degree. Only they ask for the degree, but the degree should be translated in the English. Okay, so anyone who have a degree in other languages, please get it translated first and then apply for the registration. And please be very, very clear that if you have, for example, in the February, if you have an exam, the seats will be open 2 months before that. So at the time when the seats have been opened, they will not going to register yourself right away. They take at least 10 to 12 working days to register you. So if you have a seat, for example, at the end moment, if you register yourself, then maybe you will not be able to get a seat. Okay, without registration, they will not, give you seat. So these two parts are very important. And for registration, you just need translated English degree. Okay, next. Any question is there? Anything if it's not making sense, or if you have any queries, you can ask. Next. Okay. So now we are talking about foundation of practice, theory and sciences. These are the subdivision of the part 1 exam. It's a theory exam. Please make it very, very clear. Okay. What is the difference between them? So foundation of practice, FOP, is basically a little bit clinically oriented type of exam. So what do you mean by clinically oriented exam? Like, for example, they will going to ask you to diagnose this condition. Can you tell the best step, next step when this child arrives? For example, if the child present with the fit, what would be your next step? So it's most likely, clinically oriented pediatrics. Okay. They're going to ask you about the diagnosis. So the main concentration would be, diagnosis, best next step, the best next investigation, what is the diagnostic investigation. So they are more concentrate only on this. They are not so much in detail talk about the management part, or you can say more about in detail about the different investigation. This is more related to the AKP applied clinical. Okay, it's totally different. So for FOP, they are mostly concentrate upon the clinical. They will going to ask you about the seizures, how you're going to manage the emergencies if the child presented to you with the fever, and blah 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 blah. What's for your next plan? So all it is mostly is related to the clinical part. But for theory and sciences, it's basically just like your FCPS Part 1 exam, or you can say they're going to ask you about the mechanism of action of beta blocker, mechanism of action of labetalol, phenylephrine. So they are more towards the very, very basic parts. Okay, so they're going to ask more about statistics. Okay, they are very, in this exam, especially the exam which just done in today in October exam, they asked so many questions related to the statistics, which is a research part. Okay, so they, ask almost 10 questions, came from the statistics part. So I mean, so just imagine the paper is day by day getting difficult. Okay, in today's diet, the theory and sciences, even though it looks simple, but it is not that way very simple, because we all clinicians, or we all pediatrician most of the time touch with the clinical part. Okay, and our basic part, we are forgetting, or we are not in so much, practicing with the basic part, so we forgot. We are not in research, we are not, and the theory and sciences contain ethics parts, and evidence based medicine is basically your research part, the statistics part. So they ask you about the physiology, pathophysiology. So this is all the domain of the theory and science paper. So both of the papers, have, even though so many things are common in between them, but yet they have some things, separate as well. Just I mentioned about theory and science, that specific thing related to is the statistics, or you can say pharmacology. Especially they ask so many questions related to pharmacology in this exam. And what they more ask about, they ask about, ethics more in this exam, theory and sciences. While in case of FOP, the important subjects, like you can say genetics, the important system, cardiology, respiratory, the basic medicine which we all study. For example, if you take the cardiology, they will going to ask you about the different type of murmurs, like child present with this murmur, what is the diagnosis, how you will going to proceed with this child. The child presented with VSD, having this problem, heart rate is this, blah blah. Now how you going to proceed? So these are the basic difference. So if you have any question regarding it, so you can ask it. Yes. Up till now, do you have any question, or you are very clear about these two parts? Yes. Alim, do you have any question regarding these two parts? Hina, Fatima, any question? No? Okay, next, please. Next. Okay, now we talk about the question pattern. Okay, so this is the new question pattern. So this October diet people have, a paper have a different pattern. Before that, before October, we have two types of question in the exam. We have EMQ questions and BOF, that is best of 5 questions before October. But from the October and later on, they just changed the pattern. Now you have only one type of questions. They are called best of 5 questions. So what is the best of 5 questions? You will going to have a scenario. Okay, a clear scenario is there. 4 to 5 line scenario will be there, and then you will have 5 options below, and you have to select the best option, the only one option. You do not need to select multiple option. You will select only one option from the 5 which are given. And yes, so you will have 100 questions in your exam. Okay, 100 questions will be there. All of will be the best of 5. And the duration of your exam, please be very clear, it is also changed. So before October, the duration was 2.5 years. Now it has been decreased to 2 hours. Okay, so be very clear. You will only have 120 minutes for 100 questions. Okay, so you just have only 1.5 minute for each question. Okay, and the important thing is that there is no negative marking. So if you do not have any, yes, I'm coming to this part as well, the cost as well. Okay, so there is no negative marking for this exam. So whatever comes in mind, please, try to attempt each question. Do not leave the question, because there is no negative marking in this subject. Okay, so this pattern is same for FOP and for TAS. 100 questions, all are best of 5. 2 hours is there and with no negative marking. Please, next. Next, this is done. We have discussed the FOP and TAS, both exam pattern. It's the same. Okay. Okay, so number of attempts, I think we can skip this slide. So just move to another. First, talk about the cost. People are more, towards the cost. Yes, this is a very important slide in front of you. You can see, this is the price is in the pounds. Okay, pounds basically. So you can take, if you take this exam separately, then you can see the cost would be high as compared if you take both exams same time. So for example, if you take FOP and TAS both paper at the same time, it will cost around 755 pounds. So what, Dr. Waji, 755 pounds almost cost you what cost in Pakistan? If we, convert it, any idea?
Dr. Nusrat, around about 2.7, 2.8 lakhs.
2.8, you can take as a, as a whole sum like 3 lakhs. Okay. So it cost you around 3 lakh. Okay. So this first part, if you take it combinedly, then it would take almost 3 lakh. Okay. So this exam, that is why, this exam is not such an exam that you can, uh, think to take it. Okay, just try karte hain abhi, and, just have a look and just sit with this exam. You cannot sit without preparation, because this is an expensive exam, and 3 lakh is just the first part of the theory exam. And if you take the AKP, you can see it cost more than 3 lakh. It is 870 pound. So it will cost around 3.5 something. Okay, so you can convert this. But and the clinical, it will cost more. It will cost around 5 lakhs. The last exam, I think, which when I gave it was around 4.5. And then when the next diet came, it was around 5. So lump sum, if you take lump sum, then you should have at least a budget of 12 to 15 lakhs for this exam, because you have to travel sometime. Because if you are in, from other, like from Karachi, you have to go to Pindi, Islamabad, take a flight and all these expenses. So yes, so please, the budget should be around 15 lakh for complete part of this exam without any failure. This is very important. With the ये सिर्फ first part के कि एक ही go में if you take this exam, then it cost this. So God forbid if you failed, then definitely the cost will be, you can imagine. Okay, so that is the cost of your exam. Next. Okay. So this dates, I think ये October वाली तो आज exam था, that this has been done. The next हमारे पास जो dates हैं, that is for February. Do we have February dates are in our in February when do?
हाँ जी डॉक्टर नुसरत फेब्रुअरी डेट्स जो है वो टेंटेटिव हैं, अभी रिलीज नहीं हुई, बट अराउंड अबाउट मिड ऑफ फेब्रुअरी में नेक्स्ट एग्जाम।
And when the window will be open, the application window, they have announced or not?
नॉट येट, नॉट येट।
Not yet. So this was the you can see the basically why we put this slide. The basic purpose, you can see that in October if we have exam, then in August you can say almost August means 5 August say they will open the application just 2 months back. So if you are planning to take for February, most likely the seat will be open in the November, in the last of the November, or you can say in the December. So you just have an idea about it. Okay, the seats will be open just 2 months before the exam. Okay, and how many days you have? Okay, we have two types. You can see in this slide we have online invigilation and we have a test center. So we have these two categories are there. Okay, so we have two types. We have online invigilation system, just a second, and we have test center. So please concentrate on this point as well. Again, this is very important point. We have in our Pakistan, we have two test centers. We have a Lahore and we have Islamabad. Please, next slide, Dr. Baji. In Pakistan, for theory we have Lahore, the Rawal. For Karachi, we do not have any centers. So if you see, the Karachi do not have any center. I have a good news. So for you have only one option, that is you have to take the seat only for the center. Okay, जो लाहौर में है, जो इस्लामाबाद में है, they will take only the center seats. The second thing is that for Karachi people and all those people who are living far away from the Lahore and the Islamabad center, they have second option as well. That is online invigilation. So for Karachi people, they have two options. First, they can opt for the center. Okay, and the second, they can take exam online exam as well at your home. Okay, so you can take the exam at your home as well, and you can move to Islamabad or Lahore for the center as well. So please very clear it. What are the please change the slide. What is the criteria for online invigilation exam? What happened at the time of the COVID? Please move the slide. At the time of the COVID, they introduced this exam pattern, online invigilation. Online invigilation, please, first, then we will back to this. Yes, online invigilation. So at the time of the COVID, they introduced this type of way to conduct exam, online conduction. Online invigilation was there. It was introduced at the time of COVID, and I was the first candidate when it was introduced first time. When it introduced first time, I took the exam, and when I took the exam, it was in 2020 probably. So at that time, everyone can take this pathway. Everyone can apply for the online invigilation. Why? Because of the COVID, the centers were closed. no exam were happening in the center. All the exams were being conducted by the online invigilation system. But once the COVID era was over, now they have opened their centers. Okay. So when they open their centers, so now they have a strict regulations regarding online invigilation application. Now everyone cannot apply online invigilation exam. So those who are very close to the center, like for example, those who live in the Islamabad, those who live in the Lahore, they are close to the centers, they are not allowed to take the exam online. For example, when they are going to apply for the exam, and if the seats are full, the center seats are full in a minute. So once the application will be open, you will see within a 15 and 20 minutes, the all seats are closed. All seats are closed just within 15 minutes. So if you do not have a center seat, then you will not have any option for online because you are living close to the center. So they will not take this reason that the center seats are filled, so we will take the exam online. No. But for those who are living in the Karachi or those who are living 300 miles, I think the 300 miles, Dr. Vaji, am I right?
200 miles, 200
200
kilometers,
miles,
200 kilometers.
200 kilometers. Those who are living 200 kilometers away from the center, okay, either from Lahore or from the Islamabad, the distance from the center to the home is more than 200 kilometer. If then those are applicable to take the exam via online. So those who live in the Karachi, they have both options. Please be very, very clear. Those who are living far away from the centers, especially the 200 kilometers away from the center, they could take this option. And another important thing, if you are living, for example, near the center, so you will not have a chance to take online exam, but you have a chance to take the center seat in another country. Like for example, if the Lahore, if you are living in Islamabad or Lahore, you have the seats are closed, you are unable to take the seat, so you have an option to take the seat from the you can say Dubai, from Saudi, from Egypt, blah blah. But please make it very, very clear that UAE is not giving visa very easily. One of my candidate took the seat from the UAE and she applied for visa almost 8 times. Then just 1 week back, she got a visa to give that exam. So please, you should know about the visa related strictness and regulation before opting any another country. Okay. So these options are clear to everyone. Now, please back to the side. One slide we have just left. Just go back. Is this clear to everyone? This Aleem, this clear to you? कि ये center और ये online seats का clear है concept बिल्कुल? Sabika Fatma, is this clear? Yaman, is this clear?
जी जी डॉक्टर आयशा क्लियर है बिल्कुल जी जी
Clear है?
जी क्लियर है
That's
बिल्कुल
great.
क्लियर है
अच्छा, अब हमने बात
थैंक यू
करनी है, ठीक हो गया. अब नेक्स्ट, थैंक यू. अब नेक्स्ट बात है एग्जाम मेथड. So either you are taking the exam, the theory exam I'm talking about, especially either you are taking the exam in the Dubai, in the Egypt, in the Pakistan, via online, the paper would be the same. From all the regions, the paper would be the same. Paper will be conducting at the same zone will be different. The UK perspective, the start of the paper would be same from everywhere. So किसी मुल्क में 5 बज रहे होंगे, किसी मुल्क में 9 बज रहे होंगे, it doesn't matter, but UK में 9 बज रहे होंगे, same time to be start, paper will be the same. के paper जो है वो theory exam का same होता है. But for clinical, please make it clear, clinical जो exam है, which is not our talk. Clinical exam occur on separate different days. So the paper is also changed, and paper is also, from Pakistan, the cases are different. From Singapore, the cases are different according to the availability of the patients. So the clinical exam is, depend on the region you are giving. So for example, in Pakistan, if you are giving, cases would be different. If you are giving in this Dubai, the cases will be different. But for theory, please very clear, the paper would be same everywhere. And whether you take it as online in your country. Okay, next. Dr. Vati, next slide, please. Next. Next, we have discussed the online invigilation in a very detail. Next. Now, this is a very important part, very important slide. How to start? This is a very important question. You can see in front of your screen, so many books are there. And, when you search how to start, so many suggestions will be there. So many books will be there. You will all confused. Okay. So if you want to start either by yourself or with us, no problem. The strategy would be same everywhere. What is the important strategy? To start with your exam, let me write it for you. So if you are taking the exam, if, for example, I'm talking about separately. So if I'm talking about the FOP part, okay. So if I'm talking about the FOP exam, if I'm talking about the FOP part, the FOP part, okay. So first I'm talking about FOP part. So what are the important books related to the FOP? Okay. So for FOP, the first textbook I'm talking about, the textbook is, please write it in your book. It's an illustrated textbook of Paediatrics by Tom Leisure. This is your textbook. Okay. So like for Pakistani exams, we have a Nelson now. So for FOP, this is a Nelson. This book is very important, illustrated textbook of Paediatrics by Tom Leisure. Okay. Please very clear for FOP. Other than the textbook, you need other books as well. The second, the utmost important book is this. First, I write MRCPCH clinical cases, 50 clinical cases for FOP and the TAS. So we have separate book. We have a separate 50 clinical cases for FOP. FOP ki we have separate book. And we have a separate 50 clinical cases TAS book. This book is basically issued, or you can say this book is provided by RCPCH, okay, itself. RCPCH provide this book. So this book is very, very important after your textbook. Okay. What happened? The theory part is, the first is your textbook. Second is the 50 clinical cases. The third thing, for the FOP exam, I'm talking about important guidelines. We have another book, pediatric guideline book, NHS. All these books are available in the hard copy. Okay, from everywhere. You can take from Karachi, you can take from the Dow, and but if you are living in a region where these books are not available, just go and get the printout of these copies. Okay, you should have a hard copy. So what are the FOP? For FOP ke liye, what you have written, the first is the illustrated textbook of pediatrics. If you are really interested to take the exam, please order these books. You should have these books at your home when you will start the preparation. First is the illustrated. Second is the 50 clinical cases FOP. Third is the NHS pediatric guidelines. These are the three utmost important books. Okay. Another important book, it's written over here is, let me rub this first. Another book is written Essential Revision Notes in Pediatrics for MRCPCH. Okay. This book is basically, it's also a very good book. It's from the Mark Beatty. And the book, this essential revision of the pediatrics, is mostly written in a point form. What do you mean by point form? In a bullet form. Okay. It's sometimes the people are more, used to learn or understand from the paragraphs. Some are which just need, the things in the bullet form, in the point forms. Okay. So this book again, if some people are saying that this book is good, yes, it's depend on their preference. So it's depend. Some people like to study in a bullet form. They do not need paragraphs and long and all that. But for me, if I've given my option. The first option is this. Second option is the clinical cases. And third is the pediatric guidelines. Now we are left with the past papers and the mock test. These are available and any group. If you join any group, like if you join our group, which is a free group, then we can provide you all the past papers, the mock test, so you can use this. Okay, past papers and mock tests, these are very important parts of your preparation. And but the important thing is that these past papers are basically recall papers. What do you mean by recalls? People come, they gave the exam, whatever they are recalling, they just write it. Whatever they are recalling, the options, they just write it. And what they think the answer is, they mark the answer. So the keys are not 100% right. You have to discuss these keys with your seniors, with your colleagues, or you have to check or confirm these keys with the books, with the guideline. Make sure that the answer is right. Okay, so 100% these papers are not right. You have to search it, you have to discuss it. But this is very important part of your exam. The exam, the FOP exam, what I take the review, the people were saying 80%, 80 is the, the passing ratio. It's a more than passing ratio. They are saying the paper of FOP was coming from the past papers. So again, they are giving, importance to past paper. But at the same time, if I ask about the task, they say no, the task paper was, the new questions were there. They asked so much about the statistics and the research. It was little bit tough as compared to the FOP. So you need to study the MCQs as well, the previous questions as well, along with your text as well. So you cannot rely on only one thing. If I do only the recall session, or if I just discuss the past exam, I will get through the exam. No, it's not 100% guarantee. Please, very clear. Sometimes lucks come, and 80% of the paper come from the past questions. And if you do not have a good knowledge, then it would be very confusing to solve the past paper alone as well. It's not easy to solve it by yourself, because I have already told you these are the recalls, and their answers are also varied according to the paper. So some groups mein aapko paper, if you take the group paper from our, maybe the answer would be marked different than from the other groups. So answers varied between the individual. Okay. Now I talk about the task preparation. FOP की preparation सबको clear हो गई. I'm talking about separately as well, so that if anyone wants to take or study separately, they can go as well. Then हम separate के बाद फिर एक combined strategy भी discuss कर लेंगे, जो कि 7 combined paper ले रहे हैं. FOP की सबको clear हो गई है? Is it clear to everyone? I think clear है. ठीक है, thank you. Now we talk about the task part. ठीक है, अब हम discuss करने जा रहे हैं task. So for task, the important book, the task की जो Nelson है, task की जो main book है, this is your SOP, the Science of Pediatrics. The Science of Pediatrics is the main book. Okay. So now the question arises, doctor, these theory papers, the basic knowledge, definitely do we need to know all the things, all the, Snell book, all the BRS physiology? No, they do not need intensive, or you can say they do not need so detailed basic knowledge, but yes, they need the knowledge which is relevant to the pediatrics. So just let me give the example. For example, they're going to ask you about the characteristic of, for example, I'm just giving you the example. They're going to ask you about what is the characteristic of fetal hemoglobin. fetal hemoglobin की क्या characteristic है? It is associated with left shift dissociation curve. It is associated with high affinity for oxygen. These terms all are basic. Oxygen dissociation curve, most of us are forget. Yes, we all study this curve, oxygen dissociation curve. We have already covered in our basics when we done the MBBS. Okay, it is not new, but we have forgot it. But how they going to ask? You can see they ask in the pediatric. They ask this concept with relation with the fetal hemoglobin, with relation to the pediatrics. So everything will be asked in a clinically way, or you can say the which is relevant to the pediatrics. So SOP is the book which contain all the basic part which is needed for your exam. You do not need to study any other basic book like any BRS physiology, like any SNEL, which you study in your FCPS part 1. You do not need this book. You just need this SOP. But this book is not that much easy. Please, this book is not very easy. And yeah, you have to, when you open the books, you see, oh my God, it's so difficult. But most of the time, the thing is that you need to read this book. This is your main theory book. For example, if you do not have a time to understand, or to read this book, the good thing which I tell you, a shortcut, because it's not easy to study basics at this moment, so the shortcut for this is that the charts which are given in this book, the first thing, when you are doing the past papers, whatever questions you are came across regarding the basics, just go and open the book and read it from there. So this is the only but this method is sometime work. Most of the time it works, but what I told you, sometime the different things also keep. Like today's exam, the task paper was difficult. The people find it difficult, even though we study so many things from SOP, but again, the luck depends. So either you read this book complete if you understand, but if you do not understand, if you think the things are not making sense, just read the boxes of the book. And when you are doing the questions, the solving the past questions, and came across different topics like respiratory, if you are came across with the oxygen dissociation curve, the embryology question, just take those questions and then back to the book, and just read all those basic topics from this SOP book. Okay, this is the Nelson, your textbook. Second book, again the same, the 50 clinical cases TAS, separate book. This book is separate, okay? 50 clinical cases FOP is a separate book. For TAS, it's a separate book, okay? So these are the two important books. The third important thing is that we have for TAS especially, we have a collection, past collection of the pharma questions. So most of the time, the pharmacology, they asked from the past recalls, the past questions, but it's not 100% rule. New questions do come in the exam, but most of the questions are coming from the recall part, and we have a collection for that, which we call as a jury notes, GURY notes. These notes will also be available to you all people. So jury notes, they are also in the groups. So these are the collection of all the previous pharmacology questions. So you have to memorize it. This is a very important part. Pharmacology is the 50% of your task paper. So for 50%, if 40% is coming from the past, so I think these past questions are worth to read it, to memorize it, because most of the pharma things are rut based, okay? You try to make some sense, but for example, the mechanism of action of anti-epileptic drugs, the mechanism of action of the adrenaline, beta blocker. So you have to memorize all this thing, okay? So pharma jury notes is an important part. So these three are the utmost important resources to study. The first is science of pediatrics. The second is the clinical cases, 50 clinical cases TAS. And third is your pharma jury notes. And in the last, of course, your past papers and the mock test. These are very, very important, because they will give you the idea about the exam. And most of the time, what I told you, 50, 60, 70% the paper are also coming from these papers. So you have to solve this. We have separate paper for the TAS and the separate papers, past papers for the FOP. Okay. So is this clear to everyone? This slide is clear to everyone or not? If you are studying separately, but if you are studying combinedly, so we have a combined approach as well. If you study combined, for example, you want to take the exam combined, okay? So if you have to take the combined, then what is the strategy? The strategy is that take a one system. For example, which system? You take the CVS system. Then how you going to approach? So first of all, you will read from the illustrated. Then you solve all the cardiology cases which are present in the FOP cases, 50 cases book. Then all the cases which are present in the TAS cases book. Then you go to the SOP, you cover the boxes regarding the CVS. Then you go and cover the guidelines important related to it from the guideline book. And then in the last, you solve separately the FOP paper and the TAS paper. So in that way, you will cover the CVS from the FOP perspective as well from the TAS. If you are taking or if you are planning to give exam combinedly, then please try to combine this sequence. Take from the illustrated first, then 50 cases first from the FOP, then SOP boxes, then go for the SOP TAS, CVS cases, then go for the guidelines, and then solve this recalls. And we are basically in our course, we are doing the same technique. We have a lecture. In the lecture, we give all the main ideas, then we cover the clinical cases from the FOB book, then from the task book, then we cover the separate guidelines, and then we cover the questions related to that system. In that way, we cover a one system, and most of the time we take 1 week to cover one system. So if the major systems such as CVS, if you are planning to study by yourself, so just give or at least 1 week to every system. CVS 1 week, endo 1 week, respiratory 1 week. So every system, the major subjects need a whole week for that. Okay. Any questions up till now? Is this clear to everyone? Clear? The technique, the strategy is clear to everyone. If you have any queries, you can ask in our group. Please, next slide, Dr. Vaji. Okay. So in this slide, the Dr. Vaji will talk about it. I think my part is over. So after this slide, if you have any questions, then most welcome. You can ask your queries and we are here to answer you. So Dr. Vaji, you can talk about
जी जी
this, okay?
जी जी सबको अगर मेरी आवाज आ रही है तो मैं यहाँ पे इस स्लाइड को I'll try to explain it. Basically, PrepXperts is trying to make MRCPCH easier for Pakistanis, because up till now, the most of the courses that are being offered for MRCPCH, FOP, TAS, or even AKP are all by international mentors and foreign mentors from other countries that charge a very high amount of money. For example, I have class fellows who have taken courses for MRCPCH, FOP, and TAS, and the cost for those courses were in the lakhs. 1 lakh 20,000, 1 lakh 30,000, 1 lakh 40,000, 1 lakh 50,000, and so on and so forth. Comparatively, there aren't a lot of mentors for MRCPCH in Pakistan, and right now the amount of people who are in this field it's increasing, but I think in FOP and TAS there's no one better than Dr. Aisha, especially from the reviews that our current batches, because we had two batches. One was a complete extensive course batch and one was a recall course batch, and inshallah in a couple of days I'll be sharing all of the reviews from all of our students, which were around 40 different students who are giving both the October exam as well as the February exam. So we're trying to make MRCPCH, FOP, and TAS easy for Pakistanis, affordable for Pakistanis, and so that more people can give this exam with knowledge of how to prepare for it. And for that, our next course, which is starting from the 18th of October, is a 4 months extensive MRCPCH, FOP, and TAS course for the February attempt. And it'll be starting from the 18th of October. A early bird discount is going on currently, which you can avail. Just send me a message on the WhatsApp group. And I don't think there's a better course. Yeah, the way Dr. Aisha teaches, if you've seen the sample lectures on the YouTube channel or in our groups, then you will know very well that Dr. Aisha teaches each and everything, because I don't think there are a lot of people who teach not only the guidelines, the theory, as well as the case books and recalls. So you basically have each and everything in one single course. You don't need anything else. Uh, every single aspect of the exam is covered for both FOP and TAS. So this is our flagship course. Inshallah, it'll be starting from the 18th of October, and you can join. If you plan on joining us, you can just send me a message, and we'll get the registration done. Any questions that you may have for Dr. Aisha, feel free to ask. She'll answer them.
तो डॉक्टर सलेमान मुझसे पूछ रहे थे बुक्स के बारे में, क्लिनिकल केसेस बुक्स। तो डॉक्टर सलेमान, हमारे पास क्लिनिकल केसेस, डॉक्टर उसकी पिक्चर है हमारे पास। डॉक्टर वजी, कैन यू जस्ट मूव बैक द स्लाइड? आई थिंक वी हैव बुक्स, लोगो थे ना हमारे पास प्रीवियस स्लाइड, द कोर्स रिकमेंडेड कोर्स बुक्स slide. No, we do not have a picture for that, but it's the same. The clinical cases, 50 cases, and the task cases, there is no new addition yet. We have only one addition and a one book. Okay, we do not have any new addition. Okay, Dr. Suleiman? Okay. Anything you want to ask before we end this? So you can ask it, please. Okay. So, okay, no problem. We have a group as well, general group as well. So if you have any queries, you can put your queries over there. We are here to help you all people. Thank you so much, everyone, and Allah Hafiz from my side.
Okay, ji. Okay, thank you so much. Allah.